It means a lot to me personally. So also thanks to the Rotary for allowing me to be part of these sessions. A couple of years ago, I got volunteered by my cousin, Dr. Nisbet, because he knew what my interest was, and I had no idea that the Rotary Club was doing this. So when he volunteered me, I felt a great example of a man trying to give back. That's what I want to do. So I'm happy that I've been involved for the past 3 years with this initiative. And as I should tell you, the Rotary Club is not spending any money on me to do this. So I don't have to say what they want me to say. No pharmaceutical industry person supporting me in this, so I'm not here to say anything specific about any particular drug. The Medical Association is not funding me, so I'm not carrying their messages. I'm a totally independent person. So let's keep going. And what I would like is that I want people to feel comfortable asking questions. It may be better to do it at the end, so what you should do is make your notes. And the only reason I'm saying that is sometimes people jump ahead and we get out of sync, and some people get confused, and we don't want anyone to go away tonight feeling confused. So in line of introduction, you heard some of this before. I was born in Molyneux. For those of you who are from around the area, you would know Molyneux. I left here in 1968, but I've been back several times. When I went up to Canada, I was a very sprightly young man with great aims of doing 5 years of post-secondary education and coming back to St. Kitts. I got into the system, they treated me well, they held on to me, and they're still treating me well. But now it's my turn to come back and help as much as possible. When I got into healthcare, I started off as a respiratory therapist, not a position you hear a lot of in the Caribbean, but it's a position that demands a lot of highly developed skills. Just to give you an idea, that clinical respiratory therapists work closely with anesthetists, and sometimes they take over the role of an anesthetist. Sometimes we work with heart-lung machines that keep people alive during open heart surgery. And we do a lot of diagnostic testing, asthma, and chronic obstructive lung disease. You've heard of emphysema and all those other chronic lung conditions. We do a lot of stress testing with cardiologists. So it's a very, I would say, demanding and rounded role. When I practiced, one of the things that I used to do was to travel on helicopter to Northern Ontario and other parts of Ontario to transfer very ill people into the downtown core where most of the highly specialized hospitals are located. So I've had a good life in the clinical part of respiratory therapy. But my aim was always to move through healthcare, learn as much as possible, because deep down inside of me, I wanted to have enough information and knowledge so that when I came back to St. Kitts, I can do more with the knowledge that I gathered up north. So I did health policy, I did some work with accreditation teams. Somebody mentioned I was a professor of health services management at Ryerson University. I managed the School of Health Services, which offered 2 programs, Health Information Management and Health Services Management, and a company called Hospital Administration. I've done, I would say, a lot of work regarding policy, planning, and evaluation. Evaluation is one of my weaknesses. I just love to get in there and tell people what to do, tell them what I found, and tell them how they can correct it. I'm a founder, as we mentioned, I'm the founder of a Walnut Foundation, and I did this after I was diagnosed and treated for prostate cancer. Because as a healthcare person, when I came to the other end of treatment, I thought I still didn't know enough about prostate cancer and prostate cancer treatment, even though I had what I considered a strong healthcare background. So I wondered, how are men coping with the diagnosis of prostate cancer if they don't have the basics of healthcare and any knowledge around prostate health? So I decided I needed to do something about this. Now, to be honest, I didn't do anything for 4 years. because I kept planning. I tend to do that. I'm a planner. And when I start something, it just runs afterwards. But I got a call that a gentleman who I didn't know had just had surgery for prostate cancer. I found that it was prostate cancer, having talked with his wife, and I quickly said, does he want somebody to talk to? And she said, sure, call him. This is somebody I didn't know. We had a conversation, and when he was well enough, he came up to my house, and we decided we needed to do something, especially for black men in the Toronto area. So we started the Walnut Foundation. The downside of this is that not many guys were willing to come out to a support group for black men with prostate cancer. That stigma, they don't want anybody to know. So to capture those guys, I decided that I would broaden the mandate of the foundation to men's health, with still a strong focus on prostate cancer. So we have an annual conference for men and other individuals. We have an annual symposium where we discuss one topic. We have, I would say, 9 meetings per year, or maybe 10, depends. But if we have a monthly meeting, and guys come out and present about different topics. We bring speakers in, we share information among ourselves. Guys in the group will present about their life if they would like to. One of the things that we did with the foundation is not to make it compulsory for anybody to come and say, hi, my name is Winston Isaac, I had prostate cancer. We don't do it that way because that drives away men. It prevents men from coming. So we make the environment comfortable so anyone who wants to talk about the condition can do that, but it's not a requirement. But what I found over the years that we formed the Walnut Foundation from 2007 is that men are becoming very comfortable with their health situation, and they're speaking about their experiences. They're giving tips to other guys who they know have a situation. And we are now having a lot of referrals to our organization. And when you hear the video later on, Ken will tell you that his physician actually sent him to join an organization such as ours. So you can see that there are some benefits to it. And as I mentioned on the projection there, I was diagnosed and treated in 2003. I had brachytherapy, and I'll talk about that as one of the treatments. And recently, Princess Margaret Cancer Center in Toronto trained me as a peer navigator. And what this means, once a guy is diagnosed, he's buddied up with somebody like me. So before he even makes the decisions regarding treatment, he has somebody to talk to. And it's not that he has to talk to me about brachytherapy, it's a matter of talking to me about his feelings, what his fears are, how can I alleviate those fears, and how I can direct him and his family to the appropriate treatment. So even though I'm a peer navigator, it may sound as if it's only for men, but it's for men and their families if necessary. And families could be a spouse, a partner, could be a whole family with kids, grown or young, depending on, of course, the age of the man. So that's a little bit about me. And tonight, I would like to share with you a few things about prostate cancer testing and diagnosis, and what's next in line for us when we get tested. Where do we go from here? Where do we get the information that we need to make an informed decision? And you'll see later on why I'm emphasizing informed decision. We need to have some discussion about decision-making process. There is a video that I want to show you of a complex case. Ken, who's in that video, he's a member of my group. As I mentioned, he was sent to my group after he was diagnosed. He was hoping to be here with me this year. Last year, I brought 2 guys down. This year, Ken wanted to come. Ken is an IT guy, and he's at the retirement age, gave his notice, they hired somebody. 2 weeks later, the guy said, this is too much work for one person, so Ken couldn't leave. So that's why Ken isn't here. So we did a video instead. And of course, there'll be an opportunity for having discussion. So we'll keep